Hi everyone, I am Beatrice. In today's video, we will be concluding personality disorders. So we'll be looking at cluster C personality disorders. I've done a video on cluster A and cluster B, so be sure to check it out. So today we'll look at cluster C personality disorders. So this one is characterized by anxious and fearful behavior. And as usual, before the end of this video, we'll look at some NCLEX style questions that will test your knowledge on cluster C personality disorder. So if you are ready, let's begin. There are three personality disorders under this cluster C. So the first one is avoidant personality disorder. So as the name goes, avoidant, they try to avoid social relationship. They are avoiding social relationship, not that they don't really want to interact with people or socialize, but they are afraid of rejection. So they have this fear of rejection, of not being accepted. So that means they have low self-esteem. Low self-esteem. Fear of rejection, and then they are reluctant to try new things. These people, they don't want any embarrassment, they don't want to try something new that they are not sure if they will ever get it right. So that's what characterizes avoidant personality disorder. So these are the people or the patients that will avoid group therapy, they avoid any team meetings, any gathering, because they are scared of embarrassment, they're scared of rejection. They are the ones that don't reach out to friends. Even if they really want to speak with those friends, they will rather not reach out to those friends because of that fear of rejection, that fear of embarrassment. So they prefer to just withdraw. They have that low self-esteem. So what would be your role as a nurse when caring for patients with avoidant personality disorders? So try and be gentle with them. Encourage them to participate at their own pace. Don't rush them. Give them time to participate at their own pace and give them realistic social goals. So when they are doing anything, you want them to participate, let it be realistic and it should be a small one. So don't involve them too much and be patient with them. The next one is the dependent personality disorder. So as it goes, dependent. They depend on others. They rely on others for everything, including their physical needs, caring for themselves, making decisions, controlling money, even their self-worth. They want ideas from people. They rather depend on others to do their tasks for them. These are the ones that will be afraid of staying alone. They, when their spouse is going out, they want to run after their spouse, they want to go there. They are afraid of being abandoned, they are afraid of being alone. They will ask their spouse to decide for them. They will ask the nurse to decide for them. What do you think? What do you think I should do? I can't make decision. I can't do this. Can you do it for me? Can you think for me? Can you decide for me? So these are what characterize dependent personality disorder, because they would rather not risk any disagreement. Now, because they don't like to risk disagreement, they will always agree with people. Even if it's not pleasing to them, they would rather agree so that they can rely and depend on others for anything. So what would be your role as a nurse for dependent personality disorder? So since you know that they like to depend and rely on others, avoid making decisions for them. Encourage independence with small tasks. Ensure that you help them build that self-esteem. Give them realistic tasks, small tasks, and encourage independence. So when they are bringing a question to you and they are telling you, I don't know how to do this, I can't do this, tell them, okay, what do you think about this? So you bring it back to them. When you bring it back to them, let's say they are telling you, choose my cloth for me. I don't know which clothes to wear. I don't know which food to select. I don't know which meat to order for. Then you tell them, what kind of meat you like to take? Which kind of clothes fits better? You bring out some things as options, and then before you know it, they will be the one now taking that decision. So that's your role for them as nurses. The third one is obsessive-compulsive personality disorder. These are the perfectionists. They want to do things in the perfect way, in their own way. They believe that they are the one that can do it better. So they are very rigid. They are inflexible. They don't want to change or bend their rules. They stick to rules. They stick to norms. But they do it repeatedly and do it over and over. They keep doing it until they get it in the right way. So because of that, they may miss deadline because they will spend all their time doing one task. They feel that that task is not properly done. They are occupied by rules and all that. So they keep thinking of the rule. It should be this way, not this way. And they have difficulty forming relationship because nobody can do it better than them. These are the ones that don't like to delegate tasks because they feel that they are the only one that can do it right. And they get frustrated when people cannot do the thing in their own high standard. So as nurses, what will be your role for this patient? So patient with obsessive compulsive personality disorders, you know that they are perfectionists. They want to do things and they want to take all their time. However, don't struggle with their power. So allow them take their time. So you need to give them extra time. So let's say, for instance, they are to go for do a particular activity. You need to give people with this disorder more time. However, encourage them to prioritize, because if not, they can spend the whole day doing one thing. So tell them, why don't you prioritize? Why don't you do this instead of this? And also recognize their fear of mistakes and loss of control. So recognize that their feeling of making mistakes and loss of control, so they will know that you care about them, you can relate to how they feel. So now let's look at some NCLEX type questions on cluster C personality disorders. The first question says, a client with avoidant personality disorder is hesitant to attend group therapy. What is the best nursing response? A, you must attend, it will help you. B, you don't have to go if it makes you uncomfortable. C, many people feel nervous at first. Would you like me to walk in with you? D, you are being too sensitive. No one will judge you. The correct answer would be C. Many people feel nervous at first. Would you like me to walk in with you? Let's look at why other options may not be correct. The A says you must attend, it will help you. That's like command. B says you don't have to go if it makes you feel uncomfortable. You have spoiled it because you have discouraged them by that statement. And D says you are being too sensitive. That's like you are judging them. Question 2. A client with dependent personality disorder states, I don't know what to do. Please decide for me which response by the nurse is best. A, what do you think would be best? B, I will handle it for you. C, ask your family what they think. D, that is not something I can help you with. The correct answer would be A, what do you think would be best? So this, you are throwing the question back at them. You are giving them that opportunity for self-independence. You are giving them the opportunity to decide, to take decision. Because once you give them such option, they will be the one now telling you what they think should be done. Question 3. In Dash personality disorder, the client avoids social interaction, not because they don't want relationship, but because they fear rejection and criticism. So the answer for this will be avoidant personality disorder. Question 4. A person with Dash personality disorder often avoid delegation because they believe no one can do a task as well as they can. The answer will be obsessive-compulsive personality disorder. The final question. Which nursing approach is most appropriate when caring for a client with obsessive-compulsive personality disorder? A, encourage spontaneous behavior to reduce anxiety. B, provide structure and allow extra time for task completion. C, avoid discussing routines to reduce fixation. D, set limits on compulsive behaviors using distraction. So the best answer will be B, provide structure and allow extra time for task completion. Remember, this one, they are perfectionists, so you need to provide a structure so that they can prioritize things and also allow extra time. They will need more time to be sincere. So give them extra time for task completion. So that wraps up today's topic on cluster C personality disorders. Don't forget to watch the video on cluster A and on cluster B to get the full idea of personality disorders. If you find this video helpful, please like, share, leave your comment, and subscribe for more educational videos. Thanks for watching.